Hey folks, my name is Aseem Dewan and I want to discuss with you the importance of taking a good, thorough clinical history, right? It's the age of investigation, right? There's a lot of talk of clinical scenario these days, but remember, clinical scenario always begins with history. Even in your exam, you'll get a lot of questions that you'll be expected to solve based on the history given to you, right? So someone walks in with a chest pain, you want to do an ECG, you want to do cardiac enzyme. There are some ERs in the country doing a cardiac profile, which includes an NT-proBNP to tell you whether the patient has heart failure, which includes other cardiac enzymes for myocardial necrosis. Someone comes with fever, you want to do a fever panel with cultures and Vidal and antibody and malaria antigen, right? Nevertheless, remember, it all starts with history. Clinical work starts with a history. So you never mess with the basics. That's how you work up a patient. Some of you already know this. Some of you will learn this when you become residents, right? So to cut a long story short, it was 1 a.m. and I was getting my 40 winks in the side room of our C2 ward, that's the medicine ward at AIIMS, right? So, and then when this happens and you've been sleeping for 1 hour, after you've spent 17 hours walking all over that big building, you want to incinerate your Samsung and you want to kill Alexander Graham Bell, right? Nevertheless, that's not what's possible. I woke up, the medicine CMO from the ER was calling, and he rattled off 18-year-old girl with massive hemoptysis. What's the problem with massive hemoptysis, kids? Right? Massive. What is massive hemoptysis? 100 ml to 400 ml, right? What's massive about losing 100 ml of blood? It's not massive in terms of total body volume of blood, but it's massive in terms of the volume of the trachea. 100 ml clot in the trachea can kill your patient in 3 minutes flat, right? So 18-year-old young girl, poor thing, had massive hemoptysis. There was a history of several such episodes in the last 4 years. And then he rattled off all these investigations done at premier institutes all over the country. She'd been seen by multiple specialists, all investigations unrevealing, right? That's where often a medicine man's work starts, right? Where everything else is normal, right? So as I was coming down that staircase, so for Lord Buddha, it was the Bodhisattva tree. For me, it was usually the AIIMS staircase. That's where I used to spend my days and nights, right? So I decided that all those investigations that were done at all premier institutes in the country were not incorrect. So definitely blood was not coming from the lung, right? And as I was coming down, I was a little, I was sorry for that girl, but I was amused at my situation. I was bemused, with my humble stethoscope. What am I going to offer that girl? She's been through all those extensive high-end investigations, right? Nevertheless, I came down and having made up my mind about blood not coming from the lung, I came down, asked the patient, put on a pair of gloves, picked up the government-issued torch, and at the patient's bedside, there was this attendant. He was having this bowl full of blood, and so definitely she was producing a lot of blood. Now, I had to find out where it's coming from, right? We had to fix it for her. So I asked her to open her mouth. I had nothing else to do. So I asked her to open her mouth, and she says, when I asked her to open her mouth, she goes, "Doctor Sahab, daant lagne se hont kat jata hai." That's Hindi for, my tooth scrapes against my lip and cuts it, right? So I asked her to keep her mouth open. Hemoptysis stopped. That was the diagnosis, right? It was a factitious disorder. She was biting her lip to spit out blood, right? And so we referred her to psychiatry. They found that she had schizophrenia. They put her on antipsychotics. The hemoptysis stopped. The midnight visits to the ER stopped. So kids, never forget, never underestimate the power of a good clinical history. Thanks.